Hello, Solve ME Advocacy Month participant, and thank you so much for joining in this short video on our talking points for this year's 2022 Solve ME Advocacy Month. Just a reminder that we have 3 days this month instead of just one. So the House days will be on May 10th and 11th, Tuesday and Wednesday, and the Senate days will be on Tuesday, May 17th. We'll be announcing the results of our new white paper. You can see the main findings in the center of your slide right there. That found that over 7 million individuals, or 2.3% of the total US adult population, is currently experiencing disabling long COVID, or a COVID-19 infection that resulted in their inability to continue working after infection on the long term. So our main talking points are: for the House, please care and treat long COVID. Those are two areas are in all capitals because they relate to two bills that we'll be asking for. So again, in the Senate, same thing on Tuesday, May 17th, please care and treat long COVID. This year, our narrative is very similar to previous years, except that we're really focusing on long haul diseases. Our narrative this year: post-infection illness is not new. Millions suffered from long haul diseases, just like ME/CFS, which is very similar to long COVID, before the pandemic. The pandemic caused an explosion of these cases, and long COVID is experienced in between 10 to 30% of SARS-CoV-2 infections. We are so excited to share the state tracker tool that you can use for your meetings this year. You can access that tool at www.solvelongcovid.org. And that tool, as you can see, is the picture on the right, includes all of the different numbers for all 50 states that you can go to your state and share the most recent figures from our white paper with your member of Congress. As we speak to our members of Congress, we want to thank them for the $1.25 billion in NIH research, but the NIH research is taking time, and we need the care and treat long COVID today. The Treat Long COVID Act, or HR 7482, in the Senate as S4015. This bill authorizes the Department of Health and Human Services for grants up to $2 million each for healthcare providers, including community health centers. And these grants will enable these areas to provide multidisciplinary centers of excellence. This funding will create the expansion and continuation of these clinics to address the physical and mental health needs of patients. Specifically, this bill prioritizes funding for healthcare providers with expertise in existing post-viral conditions, so that we can ensure that the best experts in ME/CFS and other post-infection illnesses are the ones receiving this money. Don't forget to emphasize long COVID's impact on the BIPOC communities, or Black, Indigenous, and people of color. The people who are likely to suffer from the worst brunt of long COVID and the lack of an infrastructure to be able to deal with it are already poorer and more marginalized communities that were hit hardest by the virus. That's from PBS NewsHour. That's a great quote you can share as well. Secondly, we have the Care for Long COVID Act. In the House, this is HR 2754, also known as the COVID-19 Long Haulers Act. In the Senate, this is S3726, known as the Care for Long COVID Act. This bill accelerates long COVID research by building research infrastructure, specifically patient registries for long COVID and related illnesses. This bill also educates long COVID patients and medical providers, including information about specific related conditions like ME/CFS, fibromyalgia, POTS, and other forms of dysautonomia. This bill will improve the understanding of long COVID treatment efficacy and disparities by expanding the chronic conditions and data warehouse research database to include long COVID and related conditions. Lastly, this bill will develop partnerships between community-based organizations, social service providers, and legal assistance providers to actually provide social and supportive services to people suffering for long COVID who will need to access these services. Ultimately, our message is clear. Because long COVID is an urgent public health crisis that is closely related to ME/CFS and requires an immediate response, and we are committed to helping the millions who suffer through these two important bills. Have a wonderful day, and thank you so much once again for participating in Solve ME Advocacy Month. And we look forward to connecting you with your members of Congress soon.